Good.
Good.
Okay. So this is Timmy Ball. He's from Bond Squad MMA. He's going to be fighting in a couple of days. But he hurt his knee a while back. He did some damage to the lateral collateral ligament of his knee. He's got a lot of swelling in this region right here. You can definitely see when he sits down, especially. But what I'm going to do is I'm going to take this compression band and I'm going to wrap it around the knee, and then I'm going to have him do some really sometimes do some squats, but not deep squats, just some pretty shallow squats. What I'm hoping to do is put enough pressure on here and have him do squats, and then when we release the compression band, it should help to flush blood and circulation through it and hopefully get the swelling to go down a little bit. And the reason why we want to get the swelling to go down is because anytime there's swelling in the area, it causes it to be weaker and more tender, obviously. But we don't want him to be pivoting or turning and have it create more damage. So we want to get the swelling out there as much as possible so that everything's circulating properly. So what I'm going to try to do is I'm going to take this thing, I'm going to pin it, we're going to bring it around the area that I want most tension, but around the back of the knee, we're going to do it as light as possible so that when he does squat down, it doesn't cause pain in the back of the knee. So once again, really cranking it over that area. Looser behind the kneecap. Is that on the spot?
No crying, Tim.
So once again, it's behind the back. We're just going to keep going around this a couple times. He'll tell you it's extremely tight. Kind of squat down. You don't have to do a full squat. I won't be able to anyways because of all the pressure. He's going to come down like that. Basically what he's using his squat muscles, his hand, using all the muscles. And so it's helping to contract this muscle, which is obviously causing more blood flow also. So I really want to bring a lot of attention to this area. So watch a couple more times. One more time. Now we'll go ahead and sit down. So I'm going to have him sit down, bring his leg up, and then we're going to try to unwrap as quick as possible. And then have him move it like that. Well, like I said, what we're hoping to do is really flush the area out, make it bit of circulation. So after we'll probably do this like 2 or 3 times. And then I'll have him lay on his back, and then we'll work it out, the muscle, with my elbow, see if we can break up whatever is left in there after doing the rubber banding.
Good.
Okay, so we did the band thing twice. I had to do some squats to see if we can clear this thing out. But now I can just feel with my thumb that there's still a little bit of gunk in there. Especially if I move the kneecap, you can just feel it right there. There's some stuff. So what I'm going to do is literally get my elbow on that area. I'm even going to push his kneecap over a little bit. And I'm going to come in through there and break up whatever is left in there. And then hopefully when I break everything up and it gets circulated out of that area, hopefully it'll be a lot less painful and feel a little bit more stable. This is obviously a really painful process. Timmy doesn't usually show any type of emotion at all. It's a little bit painful.
Made my toes curl there.
Yeah. But it's all just trying to break. I can feel with my elbow right now a lot of stuff just right there. And like I said, we gotta break this thing up because you don't want scar tissue and adhesions and swelling and stuff in this area because we don't want it to be weak. We want it to be nice and strong. And especially when it comes to MMA and jiu-jitsu, you want build a plant and not have to worry about your knee giving out on you. So we're just going to work this for a little bit, and that should be good enough for his knee for today. So that's it.